Haiti's acting Prime Minister Claude Joseph is stepping down. Joseph has led the country since the death of Haitian President Jovenel Moise. He will hand power to Prime Minister designate Ariel Henry, who was just nominated days before Moise's death. Joseph will remain in his original role as Haiti's Foreign Minister of Elections. Minister Mathias Pierre told CNN a new government will be announced on Tuesday. And COVID-19 vaccinations have come to a halt in the Bahamas. It comes at a time when countries around the world are seeing a spike in cases because of the highly contagious Delta variant. Our One Caribbean News' Deandra Hamilton explains what leaders in the Bahamas are considering in order to get residents vaccinated.
New vaccinations in the Bahamas have not waned, they have stopped because the country is short on supply and saving its current doses for those who have already received their first jab of the AstraZeneca branded vaccine. The country's prime minister is desperate for doses and some are saying bankrupt of ideas. Dr. Hubert Minnis says he is negotiating a way for vaccination to happen at the expense of the public purse, and for some it sounds preposterous.
You know, in Bimini we have had some of our residents transported to the United States by the Balearia to receive vaccination there. And we are in discussion with other cruise lines, etc., to see whether it's possible we can move thousands of our people to Florida at the expense of the government to be vaccinated.
Former Miss Bahamas and current political contender Riche Sands believes the idea of a vaccine cruise is ridiculous.
Push. I am confused. If you are going to transport individuals by the thousands to Florida to receive this, why is it that you can't bring whatever it is that you need to bring here? I'm confused. Okay, that makes no logical sense to me.
In a post on Facebook, Sands slams the government for the notion and questions why there continues to be such pressure for the vaccine, why the voluntary title for taking the shot seems to be ignored. The Bahamas on Monday announced 100 new positives for COVID-19, another death, and at least a dozen admitted to ICU at hospital. Minnis says people have a choice whether they want to remain in the pandemic or step out of it.
We're in two pandemics. The vaccinated individuals are now out of the pandemic. The pandemic is finished for the vaccinated individual. The non-vaccinated individuals are still in the pandemic.
It is said 100,000 residents in the Bahamas have received at least one jab of the vaccine.
And that was our Deandra Hamilton reporting. Well, half of Guyana's adult population has now received their first dose of the COVID-19 vaccine. That disclosure came from the health minister, Dr. Frank Anthony, on Tuesday, more than 4 months after his ministry and the National COVID Task Force began a vaccination campaign. But he said that even with 50% of adults getting that jab, the country is still some distance away from achieving herd immunity.
Been able to vaccinate 243,540 persons. So that means that we are now, for first dose vaccines, we have been able to vaccinate 50% of our adult population. I think that's a very significant achievement. In terms of second dose, we have been able to vaccinate 128,847 persons. That represents 26.5% of our adult population. We have a lot more work to do. However, we want people to understand that these vaccines are safe, they're working, they're helping to prevent deaths, they're helping to prevent severe disease, and they need to come out and protect themselves.
And Mr. Anthony said it was even more important that people get vaccinated because of the increase in cases due to that Delta variant. And he reassured the nation that all vaccines being used in Guyana have been tested and cleared for use. And switching gears in the U.S. Virgin Islands on St. Thomas, a big ship was recently docked at the West Indian Company dock, and it's all about getting first-hand experience. The U.S. training ship Kennedy arrived in the USVI on Sunday with 272 maritime cadets and 72 crew members along with some instructors. Now they're all taking part in a training cruise with the Texas Maritime Academy. All aboard the ship will not be disembarking while in the territory. WICO says all COVID-19 precautions have been taken for the ship and its crew. Now it stayed in the territory for training until Tuesday. And the chief of the Tokyo 2020 organizing committee did not rule out a last-minute cancellation of the Olympics. At a conference, Tokyo 2020 CEO said he would keep an eye on infection numbers and confer with other organizers if necessary. In his words, and quote, "We will continue discussions if there is a spike in cases," end quote. Several athletes tested positive for COVID-19 in the past few days, and COVID cases are rising in Tokyo. Muto said, quote, "Cases may rise or fall, so we think about what we should do when the situation arises." The games postponed for a year, of course, because of the pandemic, and will be held now without spectators. Japan said athletes would compete in empty venues to help minimize any health risks. Organizers report 67 cases of COVID infections in Japan, among those accredited for the games since July 1st, when many athletes and officials started arriving in Tokyo. And meantime, on the eve of the Olympics opening ceremony, nightlife goes on in Tokyo despite government efforts to curb the spread of COVID-19. The pandemic delayed the 2020 Tokyo Games by a whole year and led the government to again ban those spectators. And as the coronavirus spreads in Japan, officials have declared a state of emergency. But that has not led to a lockdown just yet. The government asked restaurants and bars to close by 8 p.m., if not just close entirely. But many bars do remain open and bustling with several customers who are all defying rules. And a lot of people just are taking their drinks outside. Health officials see drinkers as key spreaders of this disease, but they have failed to deter many from enjoying nightlife. On one recent night, city workers wearing green vests were patrolling to ask, not force, people to refrain from drinking and chatting outdoors. And as vaccine makers ramp up their COVID testing on children under the age of 12, there's a renewed push to get kids vaccinated, that is, as soon as possible. This comes as schools are getting ready to reopen for the fall semester. Steve Nance reports.
Kids heading back to school, the COVID-19 Delta variant surging, and pharmaceutical companies conducting vaccine trials for children under 12. So, when will shots be available for kids?
We are hopeful we have a safe and effective vaccine for younger children before the year is over.
The CDC director making that prediction during a Monday virtual meeting with a group of 24 business groups and public health organizations. The group announcing an initiative to help working parents get their eligible children vaccinated against COVID-19 and get caught up on routine vaccinations. Meanwhile, Pfizer and Moderna are still doing clinical trials to see how coronavirus vaccines work in children under 12. Pfizer saying data for children 5 to 11 could come sometime in September. And depending on the findings, it could ask the FDA to authorize emergency use of the vaccine for that age group that same month. Moderna has not said when it could potentially have its trial data results.
We still don't have the complete picture as data in this age group are limited, but we do know that even children with mild cases of COVID may face serious long-term effects.
Right now, all but 4 states are seeing an increasing trend in new daily COVID-19 cases, with doctors describing patients who are younger and sicker than those they saw in the winter. Health experts say right now, the best way to protect young children is to get shots into the arms of everyone else around them.
The ones who will also pay the price, other than the unvaccinated adolescents, are the little kids who depend on the adults and adolescents to get vaccinated in order to slow or halt transmission.